Hi, my name's Sandy, and I'm a Canadian Gynecology Oncology physician assistant.
Hi everyone, my name's Sahand, and welcome to the Canadian PA YouTube channel. With me I have Sandy Vuong, who's a PA working in Gynecologic Oncology in downtown Toronto. Welcome to our YouTube channel, Sandy.
Thank you for having me here.
So, really weird that Sandy actually is joining us here because Sandy was one of the few PAs who I've had the pleasure of mentoring even before she got into the PA profession and throughout her PA career. So it's actually really exciting to see you here now as a full-fledged Gynecologic Oncology PA. How does it feel?
I think I'm very excited to be where I am at now, and like you said, I don't think I would have been here without meeting you in the first place.
No, I don't think I had anything to do with actually Sandy getting into the program as much as I just kind of helped guide her through the program. Mm-hmm. How does it feel to be a Gynecologic Oncology PA, or more importantly, what motivated you to become a physician assistant?
Well, this all kind of started back when I was in fourth year undergrad. I was looking for a career in healthcare, and I was looking at healthcare programs, and upon doing my research there, I found the physician assistant program at McMaster University's website. And going through my career center, I did find a physician assistant who went to University of Waterloo. So I kind of connected with him and met with him, understand what his role was, and that really just made me very interested in the profession. And so I decided to apply, and once I got into the program, this whole profession was really amazing, and that I could practice medicine alongside with physicians, nurses, etc. And right now, when I'm working in gynecology oncology, I feel that I am having a very fulfilling career. I have a certain amount of autonomy that I'm comfortable with, along with my staff. So I'm really happy with where I am at now.
Great. So you mentioned your work in Gynecologic Oncology. Can you explain to some of our viewers what is Gynecologic Oncology?
Yeah. So Gynecologic Oncology is part of is under the branch of surgical oncology. So this is where the surgeons have specialized training in tumors, especially cancerous tumors, and the management of it. So in Gynecologic Oncology, our surgeons is the only specialty that does the surgery to remove the cancerous tumor and also administer their own chemotherapy. So Gynecologic Oncology is under the subspecialty of surgical oncology. Our surgeons focus on the female pelvic organs such as the uterus, tubes, ovaries, vagina, vulva. And for our surgeons, we focus on the surgical removal of cancerous tumors or any tumors suspicious of cancer arising from those organs I spoke about earlier. And we are the only, the Gynecologic Oncology surgeons are the only specialty that removes the tumor and also administer their own chemotherapy, whereas with other surgical oncologists, they do the surgery, but a medical oncologist administers the chemotherapy.
Okay, great. That sounds very interesting and very specialized. What is the role of the PA in this setting?
So I've worked in two cancer centers. I started in the Gervasey Cancer Center in Hamilton, and recently moved to Toronto and working in Princess Margaret Hospital. Both cancer centers see a large volume of patients, actually. So my role, I find, with the feedback that the staff and the nurses have given me, is that with the constant changing of the residents and the learners coming by, I'm really the constant there. I work with 5 to 6 surgical oncologists in gynecologic oncology. So whether the patient is seeing this doctor or they have to see another physician because their primary care provider is away, they could always come to me because they know that I'm always there in clinic.
Mm-hmm. Great. And what sort of things are you doing on the day-to-day role as a gynecologic oncology PA?
Mm-hmm. So I work in clinic almost every day,
okay.
Unless I'm needed in the operating room. And what the patient could expect when they come to their appointment to see their gynecologic oncologist is that they first will see me. I will go in, I'll depending on what their visit is, take a history and do a physical exam. I'll review what kind of concerns that they have and try to address those if I can. And then after the history and physical, I will review with my staff. And I generally have a plan about what I would like for the patient to do. So if they are here for a chemotherapy visit, their blood counts is okay, they have all their prescriptions, and I let the staff know and said I think they don't have any other concerns, and the staff is happy to just see the patient quickly and say bye.
Okay, awesome. And for our viewers who may not be familiar, what Sandy means by the word staff is specifically her supervising physicians who she's working with. Now, that seems like it would actually help improve access to care, speed up the care that the patients are receiving, and likely, probably, you find that they're probably receiving better care in the sense that you can probably spend a little bit more time speaking to the patients and addressing some of their more complicated concerns more thoroughly. Do you agree?
Yeah, I agree. So, like, you're right. In especially in oncology, we have patients in different stages of their battle with cancer. You have at the time of diagnosis, surveillance, under treatment or palliation. So towards for the more symptomatic patients, for example, patients undergoing chemotherapy might have a lot of side effects. And when they list those concerns to me, I could try to come up with a plan on how to manage those. I review with the staff to see if they agree, and they might tell me, Sandy, I think maybe we should decrease the dose of this chemotherapy agent, and then I will go back in and review the plan with the patient.
Okay, great. I know you said that a lot of your role is focused on clinics. Are there, for certain surgical PA specialties, there's also a lot of procedures that someone might be doing. Is this something that you do in your role, or are you more focused on the clinical setting?
So when I was at the Vuong Cancer Center, I was their first physician assistant in the Gynecologic Oncology service. So they did try to put me in different settings. So I was in the OR when there are short pair of hands to help, such as with large pelvic masses or with ovarian debulking surgery. So debulking surgery meaning that they're trying to remove all the tumors that they could see in the abdominal and pelvic area. So that's one of the things that I enjoyed doing when I was at the Gynecologic Cancer Center, assisting in those procedures. And in clinic, I do other procedures such as when patients present with ascites, meaning they have fluid in their building in their abdomen. So I would, under ultrasound marking by the radiologist, I would do the paracentesis. Also, other procedures that I do regularly in clinic are like pap smears, biopsies, such as in vitro biopsies, vulvar biopsies, and such.
And again, having you in the clinic to help do some of these procedures, which a lot of the time may take a substantial amount of time to perform, is probably really helpful for the surgeons that are there, whereas instead of having to do the procedures themselves, you can act as an extension of them and help complete these procedures for them, which I'm sure they appreciate.
Yeah. So while doing the paracentesis, you're draining liters of fluid. I'm there from start to finish with the patient while my staff can continue seeing the next patient.
Exactly. Which is in essence what we really hope the PA role can accomplish. All right, so Sandy, that was actually very useful. Now, what are some tips that you have for our viewers who may be interested in becoming a PA?
Right, so just leading back to our very first question, I think it's very important that students who are interested in applying to the physician assistant program or understanding more about the PA profession in Canada is to really talk to a practicing physician assistant. So just like what I did when I was in fourth year undergrad, I would contact, I think on the Canadian Association Physician Assistant website, there is a contact that you could reach out to see which physician assistants are practicing and who is willing to talk to prospective students. So I think that would be good. And even better if they could bring the students into their workplace and see how they function.
Okay. Awesome. So, I mean, I think that's all very helpful. We can definitely add the links to some of these websites as well as some other blogs and websites that the viewers may be able to refer to that can give them a little bit more information and insight into becoming a PA. We'll have this link in the show notes below. I'd like to take this moment now to just thank you, Sandy, for taking the time to come and join us to record this video and to be on our YouTube channel. It was a pleasure having you, and I look forward to continuing to see you grow as a Canadian PA. All right, and for all of our viewers, I hope you enjoyed this video and learned something from it. We'd appreciate it if you took the time to subscribe, like, and comment below. Please also share this video with any of your family or colleagues or friends who are interested in this profession. Sandy, it was great having you on, and keep up the good work.
Thank you.